Again, 19 degrees, your current temperature. We'll take a look at the weather in a little bit, but right now we've got Dr. Kyle from the Dent County Vet Service here in town, and he's in to talk about some various topics about your pets today. And by the way, if you do have a question that you would like to ask Dr. Kyle, you're more than welcome to call at 729-6659, and he'll be more than happy to answer your questions, won't you?
Yes, sir.
All right. We mentioned earlier that today might be a good topic. Older dogs.
Geriatrics.
Well, just let it go.
Okay. Well, it's something we deal with in the veterinary world more and more now as dogs and cats are getting older and older. It's not terribly uncommon now to see a cat cross 20 years of age, which is up there pretty high. And we have dogs also are slowly increasing lifespans also. So we do have a longer amount of time they're in a geriatric life phase, and something that there's more and more now available, more things that can be done to help in a variety of things. But it's just something we're seeing more and more commonly. So we're just letting kind of people have some information about that.
Probably a lot has to do with that is better nutrition than used to be.
Absolutely, no question. But we also now have better vaccines on certain diseases, parvovirus and distemper and those kind of things that are not as tough anymore. We have fewer cases, although we still see them. We have also, a lot of dogs now live in a less harsh environment, as a higher percentage of dogs now live indoors than outdoors, and cats same way. A higher percentage of them now live indoors, and it makes a difference in lifespan. They do last a little longer when they're indoors in a less stressful environment.
So, what are some precautions or things that we need to look out for with older pets?
A number of things, and let me take one step back here and define first what we call geriatric. And essentially, we've moved away from dog versus cat. Now what we say typically is the last third of the lifespan, and the last third, can vary even in dogs from breed to breed dramatically. We know that on average, smaller breeds last longer. And the bigger the breed gets, typically lifespan is expected to be a little bit shorter. And the Great Danes and the St. Bernards and the big dogs we were discussing earlier, 10 is a pretty average lifespan on these guys. Occasionally 11 or 12, but it's not many go beyond that. It's just their things wear out and they get old, and problems come in that cause mortality at some point. Cats, we're looking at probably if they're averaging, 15 to 20, then after they're about 9 or 10, that's considered geriatric. And in little dogs, not too different. Anything after usually around 9, and little dogs is considered geriatric. And in big dogs, usually at age 6 or 7, they start in a geriatric period of life. So in defining exactly what we're calling geriatric, that's kind of some borders on it a little bit, some parameters. You asked about things to watch for. Certainly indications that function is declining, and particularly things like mobility, things like urinary behaviors or defecating behaviors, all the kind of things that can get into troubles as they get older. And mobility is the one we can see the most easily, but variations in how much an animal drinks can be something that's wrong, and it can easily slip past people. Ask them if a dog drinks, they say, yeah, he drinks real well. And often if I press a little bit, I find he's drinking too much. Drinking too much is a sign of problems, often kidney issues, and they get older, a problem, sometimes diabetes, sometimes Cushing syndrome. There's various different things that are subtle, and drinking and urinating outside of normal parameters is sometimes a clue, so that's something to watch for in older ones, typically.
And my dog talks to me, but he can't tell me what's wrong.
Exactly. Mm-hmm. Yep.
But like you say, though, you can see a lot of signs if you know your animals.
Right. And if watching for them, things that you watch for, if you're kind of keeping an eye out. I routinely here in the office that I have an old dog and he's not in any pain, but he's just slower anymore. And the first question I have is if he was going to tell you, what words would he use? And they don't have any words. And so the things I look for is how quickly do they get up and lay down? If they hop up fast and lay down fast, they probably don't have much hip problems. But if they're slow to rise or slow to lay down, and when they go to a stair or a jump, do they pause and think about it a minute, or do they just go? Because the more they pause, the more it's probably going to hurt a little bit. And so they're thinking, "Ugh, do I want to do this?" Or climbing stairs, or hopping in the back of the truck, or hopping in the car, or all those things that we see them do differently when they're 5 years old than when they're 10. And so those are all signs of discomfort, but they're not vocalizing. Right. And so people sometimes think if they're not vocalizing, they're not in pain. And now that we're defining better in vet medicine the measures of pain, only when you have a long-term pain the vocalizing that happens has to be at a pretty high pain level to even do that. They don't do it when it's
Right.
now when it's a brand new pain. If they just twisted an ankle or twisted the hip a little bit, they'll vocalize right then when it's a new pain. But if it's been there for weeks or months, they typically don't make any vocalizing, unless it's really bad.
Right.
And so it's don't look for vocalizing to be the main symptom of pain. There's things like just reduced activity, choosing to not do things they used to do. Choosing to lay around more and not, get up as much, making shorter walks instead of longer ones. There's all those things are indications that they may be a little soreness. They just don't really want to go that much.
Right. And if you do have any questions, you can give us a call at 729-6659. Dr. Kyle will be happy to talk to you about that. The bigger dogs, I know you see hip problems a lot more probably in the bigger dogs than the small dogs,
Yeah.
although they have that too. And when we were talking about nutrition, there are foods that are formulated to help with that, right?
Yes, there actually are some specialty diets that have had some ingredients either increased or added to improve mobility. In fact, for Hill's Science Diet has one called JD, joint diet's what it's for. Purina has also some things added to some of their specialty diets to help with hips and with joints in general. So there are several things that help with that. This is sometimes where I lean towards premium diets when a dog has some problems and needs some special things that may benefit from more than just a grocery store brand. Where you just the average dog that doesn't need anything special on them. So
Do you see that dogs sometimes have or maybe develop as they get older allergies to certain foods?
yes, and allergies can develop at any time in life. Mostly after a year in most cases. However, most allergies to food ingredients, and I don't like that term. It's what everybody uses. I like protein allergy is a better term. They can develop, and oftentimes between ages of 2 and 5, but they tend to magnify with age sometimes. And so you do see some develop at older age, but many of those are already existing. They just worsen as they get older. And I say I didn't like that term too much. We have not found dogs to be allergic to water or to minerals or to vitamins and things. It's generally to proteins. That always brings a need for a clarification in the fact that proteins are what the allergies typically form to, but there are proteins that are in many carbohydrates, like corn or wheat or oats or barley. They all have proteins in them. And some dogs have an allergy to the proteins that are in corn, so we call it a corn allergy. And it is a corn allergy, but it's to the proteins that are in corn, not typically the carbohydrates. And so that does typically happen, and it can be managed, and there are diets that help with that a little bit, but it can show up for dogs for sure.
Yeah. I know we had a Mastiff before we got the dog we have now.
Mm-hmm.
We were talking earlier, developed the pads on his feet would just be sore. And they kind of determined that it was an allergy to the corn that was used in feed. And I guess corn is used as a filler a lot.
Well, every dog food, actually, let's say all the good ones and all the decent ones. There are some real junky ones that don't adhere to this, but every dog food wants to fill all the food groups. And the food groups that we have fats, protein, carbohydrates, vitamins, minerals, moisture. That's our big ones. And many of them lean toward available carbohydrates, which corn is one, wheat is one, barley is one. There's a number of them that are and the ease of availability affects how much you can get for what cost. And when they're easy to get a hold of, we have a lot of corn in this area, so it's easy to get a hold of. Is corn a good or a bad ingredient? Depends on the dog. Most dogs, it's perfectly fine. A few dogs develop an allergy; they shouldn't eat corn. Some develop an allergy to wheat; they shouldn't eat wheat. So it's as an ingredient, it's okay. But if a dog has an allergy, we steer to something else. Once if you can identify what the allergy is, and so that's
What's the oldest dog that you've seen in the clinic since you've been here?
The oldest dog I've messed with, we were talking a minute ago, was actually it wasn't in this clinic, but we just had to euthanize our dog short time ago that almost reached 19. It's a Shepherd Malinois mix, we think. So she's almost 19. That's the oldest one I've seen in a long time as far as the bigger dogs. But we do see commonly dogs that are. We did a surgery a day on a 15-year-old Chihuahua that had a little lump to take off and had a little pyometra. So 15-year-old is it's an old one, but she did fine. Went through it just fine.
When you took the lump off, we talked last time. You've got a laser in. Is that what you used then?
Yes, actually, we used it afterwards, but not during. The particular laser that when we have is not a surgical laser. It doesn't cut things. It treats things to help healing and to decrease pain. So we did use that afterwards, but not actually to cut this thing off. We actually did a normal standard surgical procedure to get the lump off. And this one, as we move along now, we just got our gas anesthesia machines almost functional. We got to get a technician in to get them running, but they'll be ready soon. And I'll use that on all older patients because it's safer, coming up pretty soon. And so as I go to surgery with problems, these older dogs, I do special things with them. We always pull blood work, check on organ function first, and then always give them fluids. And we always use gas. There's several things that we do that are to help reduce risk in surgery for the older dogs.
And you've got that pretty powerful laser in there, don't you?
Yep.
Have you got some new equipment in since we talked?
A bunch. We got the blood pressure machines in. We used it just yesterday. I think we used it on a little cat. We've got patient monitors in now to monitor during surgery stuff, and it's about to be ready to run. It's here, but it hadn't run quite yet. We just worked out an agreement with a company to get all of our in-house blood chemistry machines running in-house, so we can run things right at the point we need it right there. And they also have just given us access to their reference lab that'll have about an 19 hour turnaround time. So we send it off in that afternoon. Next day it's in, or we can run it in-house and have it right now, depending on what the dog's needs are and how fast this patient needs the results. Right. So those are all coming in. We've had some. Steve Strickland's been down there for the last few weeks. We got 3 back rooms that are all now remodeled, ready to run. Surgical prep room, surgery room. We just installed an isolation room. We have a place to put contagious animals now that's separated from everything else. And he just did our procedures room in the back as we've done. So we're moving forward in the clinic and getting ready to do the lobby here next. That'll be coming up pretty soon here. So.
And I guess we should have covered this first, but give us your location and phone number.
Yeah, we're at 403 North Henderson, right down in same location it's been for lots and lots and lots of years, Dr. Toon's old place. And we're about a block, I guess, up from the police station, right there by the library and the church there. So right down there, the new blue building. We painted it blue. It should be easy to see that way.
There you go. And what's your phone number?
It's 729-6100.
Okay.
I remembered it. That's pretty good.
Yeah, usually I have to look at my phone to see what my phone number is. You know, we had a question brought in. We kind of talked about this last time, but it was just brought in to us. Winter weather, we've got that going on, or will be going on before too long, and outside pets. What are some things that we need to do?
You know, we talked a little last time, but I really carefully assess the level of risk for this particular patient, this particular animal. Let me give you an example here. If someone says, I've got a 1-year-old chow dog that he's got a dog house, he's got a covered pen outside, that dog is kind of low risk. A chow's got a very thick hair coat, lots of hair. He's a 1-year-old, active, healthy puppy who, he's probably happy when it's 30 degrees. He loves it out there like that. And that's one of the least risky animals you'd have, just because he has such a heavy insulation coat. Other end of the spectrum, to me, would be a 13, 14, 15-year-old Chihuahua who has almost no hair to cover him, who has probably not a lot of fat, hopefully, who has very little small body size. Small bodies cool faster than large bodies do. And if he's, out in a cold wind, or she's out in the cold wind and with that little short hair coat, sometimes 15 minutes they're going to be having troubles, just that fast. So I look at risk level. Age makes a difference. Level of activity makes a difference. Hair coat makes a difference. All those things, matter.
And sometimes even those smaller dogs that are outside and they've got a house and they've got a place to get in, they're still going to be cold.
Yeah. Yep. If your dog has to be outside, I know when I used to train bird dogs for a living, I had some guidelines I went by, and I had short-haired pointers that didn't have a lot of long hair. And whenever it went below about 45, I'd put 2 dogs together. If it went below 30, I put 3 dogs together. Thicken up the hay. I mean, a lot more bedding. I'd put a flap on the door to keep that wind out. Just start increasing what we do to try to decrease the exposure to cold weather as it get colder and colder. Because we had 34 dogs, we couldn't bring them all inside. It wasn't a place for them. But they did well like that. Right. I have seen patients come in that get into cold problems, and when there were situations where there was wind, if moisture gets on them in and around that cold wind, it magnifies the problem. They get cold.
Freeze quick.
Absolutely. And I've had some dogs that had problems that people they surprised them because they'd been that way for 12 years. He's done fine. I said, but now he's 13 years old. He's not 2 years old anymore. Right. And when metabolism goes down, activity goes down, and muscle mass goes down, they are now more susceptible to cold weather problems.
And that's going to be true with the little kitty cats too.
Absolutely. Although long-haired cats do pretty well, and cats, they're better at finding a out-of-the-wind place to go hide somewhere. It seems like dogs are a little more likely to sit in the wind or sit out where it's windy. I do see problems when little dogs are put out to go to the bathroom and something happens, the kid falls and hurts himself, or the phone rings and people get distracted and they forget to open the door. I see problems sometimes when those kind of things happen where it's not intentional. It's just something crazy happened inside and they forget to let the dog back in. So.
Right. We've still got time for a question or two if you would like to call in. 729-6659 is the number that you can call. What are some of the other topics you'd like to cover today?
Well, one thing I was going to mention is things that people can do to help their geriatric dog do well during those older years. And a couple of things that have been found to be helpful in scientific research is one is at an interval that's not too far apart to occasionally check blood work on them and see, are kidneys okay? Is because you can't see that from the outside really. Is liver okay? Is our blood doing okay? Sometimes you can catch things early. You can address them and fix them sometimes. Where if it's real far down the line, if I see a dog with early kidney failure, I can usually manage them for several years sometimes. If they're way down the line, I can't do a whole lot when those kidneys are done. I can't do a whole bunch then. They've tried kidney transplant programs, but you got to travel somewhere, and it hasn't been very successful. It hasn't worked very well. So that occasionally helps. Also, just have an exam every now and then. Have them just find like little lumps and bumps. Look at the gum, teeth. There's things that you can look at that sometimes the owner doesn't look at lymph nodes, and they don't look at those things. And so get them in some to your local vet. Have them look at it every now and then. More often when they get old, because there's things show up faster. Another thing we'll do sometimes in those older ones is certain supplements help some of those guys. Sometimes things that help joints a little bit, or there's a variety of things that can help as far as them having a little less joint discomfort or a little less inflammation, a little less allergy, and just keep them feeling a little better. So those are all things that can help a little bit. Sometimes an alteration on diet type when they get older. There are geriatric diets that are made for older animals that have a different mixture as far as fat levels, protein levels are a little bit different sometimes. So those things can help also.
Well, I think a lot of times people with their dogs or cats or their pets in general, they never even think about going to a vet until something goes wrong. Mm-hmm. And probably people are kind of the same way. They don't go to the doctor till something comes up wrong. But how often should people bring down their pets and have them checked out? Like you're talking about the blood work or just an overall checkup?
There's basic guidelines. Each patient's a little different, but the thought is in getting their life started fairly often when they're little, when puppies, to just make sure joints are developing okay, make sure they're they have a good bite, make sure they don't have any hernias, just things that you check on when they're real little, and then vaccines when they're little. Middle age, most of them can go a little longer. As far as just sometimes people just once a year for their checkup and vaccine stuff. And some of those guys now, some of these guys can have things that last even longer than a year or two. And so sometimes they'll just come in sometimes for a checkup or wait their vaccine sometimes 2 and 3 years between, depending on how many they've had and what protocol they've had before. As they get into older age, I always recommend just at least once a year. If they get into really older age and they're doing okay, I'll sometimes even say twice a year. Let's just check things and make sure that things aren't developing that we can catch early on, because the older they get, the harder it is to address certain things surgically, those kind of things. So it's
if somebody brings their pet down and you haven't seen them before, does the initial visit take a little longer maybe than?
Sometimes getting a history, just trying to figure out what's in this animal's background, what things do we be looking for this one. So not a whole lot longer, but just a few minutes, especially if a dog doesn't have a lot of problems in his background. It's pretty quick. If they have a lot of history, then it helps to kind of at least become familiar with it and just hear what's happened, just hear what's treatment they've had that worked and didn't work, just to have some moving down the road of knowing what this animal might need. So yeah.
Okay. Any other topics we need to cover while you're here?
Okay. Anything question-wise is fine. There's or if things people have questions about what to do with older animals, call us at the clinic. We can go through some basic questions and kind of figure out how for that particular one, because each one's a little bit different. But that's fine.
And we're still planning on doing this the last Wednesday of every month, right?
As far as I know.
All right. Well, I look forward to it because we get a lot of good information. Again, tell us where you're located at and give us phone number again.
All right. We're down at 403 North Henderson, and MacArthur's on the back side of the property there. And it's if you go on the back side of it, you'll see where the old cattle pens were, where they did cattle stuff before. We are our phone number is 729-6100, and things we'll cover in the future. As spring comes a little bit, we'll talk about things like heartworms, things like intestinal worms, which we see them even when it's this time of year. We had a number of cases lately here. We'll talk about parasite stuff like fleas and ticks as they come out. We'll talk about probably some heat problems as the summer goes along. Talk about how to work with hot weather type problems too. So, and then if somebody has a special question, we'll answer it, or a subject they want to hear about, we'll deal with that too. So.
I'll be glad when we start to talk about warm weather problems.
Won't be too long though.
It won't be too long. All right. Well, I appreciate you stopping in today.
No troubles.
And we'll work on getting you some questions for next time and some subjects to go over.